Hi, this is Randy Wykoff, Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the pandemic update with data accurate through June 16th, 2022. This week, I'm going to do something a little different at the request of one of the viewers, which is I will, of course, talk about COVID, but I'm also going to provide some information about monkeypox because that's been in the news and it is also a potential pandemic issue. So the question with COVID is, are we continuing to see the downward trend in statistics? And if you look at global deaths, it does look like it's beginning to level off a little bit, but still well below where it has been at any time since the pandemic began. A little over 6 million deaths worldwide and about 1,200 deaths a day. So while we can be pleased with the reduction in the number of deaths, it certainly isn't approaching zero. In the United States, we've been watching the number of cases going up for a while, but as you can see, for the last couple of weeks, it seems to be leveling off the day-to-day number of cases. In terms of hospitalizations, though, we are seeing a continued increase in hospitalizations, and that's a little bit worrisome because that's one of the fixed statistics, right? Cases can be dependent on testing, but hospitalizations are a pretty good measure of what's really going on. It stands a little bit in contrast to the number of daily deaths, which, as you can see, for the last couple of months has been very low. In fact, the lowest it's been at any time except about a year ago in the summer when it was slightly lower. We've seen over 1 million deaths in the U.S. and about 275 deaths a day. And that's less than a tenth of what it was during the major peak before. But it is, as I say, a little bit higher than what it was last July. In terms of the last few weeks, we've been watching the number of cases slowly increase in the Northeast. It looks like it's coming down into the rest of the country. And then what you can see is now starting to darken up in a number of places, including in central Appalachia, in Kentucky. And in Kentucky, if we look at the number of cases and the number of deaths, we can see a slight increase. Now, all of this stands in contrast to what we're hearing from folks on the clinical side, right? The clinical folks are telling us that they are seeing an increased percentage of positive tests and an increased number of cases. So how are we seeing an increased number of cases, but not a real significant increase in hospitalizations and deaths? And I think the reason is, I think we are seeing a surge in cases, but I think what's happening is now most people have some level of immunity, either from previous infections or from the immunization, from the vaccination. And so the cases are less serious. We're still seeing a pretty big dichotomy between cases and deaths in those who are vaccinated and not vaccinated. But because so many people now have a level of immunity, I think these cases that we're seeing are less serious. Now, how long that will last? Will the cases start getting more serious? Will our immunity wane? We don't know those things. But I think for right now, we can say reasonably that we are probably seeing an increased number of cases, an increased spread in the virus. But fortunately, because most of us are now have some level of immunity, we're not seeing the really serious outcomes. We'll keep our fingers crossed and hope that's not going to change in the future. Now, I've been asked to talk a little bit about other things going on in the world besides COVID, especially now that the numbers are coming down for COVID. So I thought we should talk about monkeypox this week and maybe another subject next week. So the World Health Organization and the CDC are tracking cases of monkeypox in areas that don't normally have the disease. You've probably seen the headlines that they're considering this a real threat to the public health. There are parts of Africa where monkeypox has historically existed, what we call an endemic disease. But what we're seeing now is the spread of monkeypox in places that have not historically had it. It's been reported in almost 2,000 cases in 35 countries, as you can see, mostly in Europe and North America. In the United States, There's no real pattern yet to where we're seeing the disease. Really, it seems to be tracking with the largest population centers. So what is monkeypox? Well, monkeypox is what they call a pox virus related to smallpox or cowpox. So it appears to be much less severe in humans than smallpox, thank goodness. It's what we call a zoonosis. It's spread from animals to humans, but can also spread human to human through close contact, body fluids, respiratory droplets, maybe contaminated material. Lately, there's been some reports that some of the cases, not all of the cases, are spread with men that have sex with men, but obviously any sexual contact could potentially expose someone, but also any other close contact. Think of the disease as having 4 phases or 4 periods, right? 7 to 14 days typically after exposure, sometimes longer. Then you get a prodrome, which is before the actual rash appears, fever, muscle aches, headache, weakness, and swollen lymph glands. And then the disease starts with what we would call a 4-phase rash. What's a little bit unusual about this is it will start often in the mouth, and then it would be more common on the extremities and on the face, maybe on palms and soles, which again is relatively unusual. And then the rash may be painful. And then after a period of time, the lesions start to crust over and then the scabs drop off. When the scabs drop off is when you're no longer infectious. So when we talk about a 4-phase rash, we talk about macular, which means flat. You can see it, but you don't feel it. Papular is raised, but it's not fluid filled. Then vesicular, it's full of fluid. Pustular, it's full of pus, body protective material. And as you can see, there's what we call a central umbilication. And then the lesions crust, scab over, and then the scab drops off, and that's when you're no longer infectious. It's usually a self-limited disease. It doesn't mean it's not serious, but it can be serious in children, pregnant women, and those with immune suppression. The death rate can be reported as being close to 0. But typically in the natural form, it seems to be 4 to 10%. Then maybe the deaths come because of secondary complications like secondary infection. The wounds get infected, pneumonia, blood infections or sepsis, encephalitis, and inflammation of the brain, loss of vision. It can result in stillbirth if it's acquired in pregnancy. It appears that the smallpox vaccine is about 85% effective at protecting people. There's been some suggestion that we should use the older smallpox vaccine. The WHO does not recommend that, but it does recommend using a newer smallpox vaccine, especially for people that are close personal contacts or healthcare workers that are likely to be exposed. I would remind you, as you all know, that smallpox has been eradicated, so there's no other natural need for the smallpox vaccine. There are antiviral drugs that have been approved, and like many diseases that can spread from human to human, there is an isolation period of 21 days. This is not, interestingly, the first time that monkeypox has been in the United States. In the early 2000s, there were dozens of cases in the upper Midwest. They were associated with pet prairie dogs, not just pet prairie dogs, but prairie dogs for any other purpose as well. And apparently the prairie dogs had become infected from some animals, small animals that had been imported from West Africa. The U.S. gave the smallpox vaccine to some people, either pre or post exposure, and there were no deaths. There was an interesting personal friend of our family that was impacted by this pandemic, this outbreak, but that was another story. Right now, the World Health Organization is trying to decide if it should rename the virus and its variants. They don't like to name diseases for animals or regions, especially in this case, because it doesn't appear to be naturally a monkey-related disease. And obviously, it's now spreading all over the place, places where there haven't been monkeys for a long time. But they're also trying to decide if it should be classified as an emergency of international concern, basically an evolving pandemic, if you will, a term that they only use right now for COVID-19 and polio. So In terms of COVID, are we seeing a downward trend? Yes, but probably we are in the midst of a surge in cases. Fortunately, not particularly serious for everyone, serious for some people. And what you should know about monkeypox is that we are in the early phases of a global outbreak. No one can tell you right now how common it's going to be, whether we're going to need to take action to control it in terms of vaccinations or something else. We simply don't know right now. So obviously, as always, there's a lot of information on the College of Public Health website. As we start to expand beyond COVID, if there are people that are interested in other public health issues, please share this video with them. Let us know what you think. Thanks as always to Dara Young for editing, producing, and posting this video. And if you have any questions about COVID or other emerging public health issues, please let me know. I look forward to hearing from you. Until next week, I hope you're well.